You know, if you've ever been stuck dealing with chronic back or neck pain, you know how frustrating the options can feel, right? It's like you're forced to choose between just managing the symptoms day to day or taking a really big, drastic leap. But what if there's a missing link in that whole healing equation? What if there's a way to put it all together that could finally be the answer?
So let's start with a number that I think is going to hit home for a lot of us. 80%. It's a massive figure. So what is it? What does it represent?
Well, that's the percentage of adults who are going to struggle with really debilitating back pain at some point in their lives. I mean, this is not some rare condition we're talking about. It is the single most common reason people miss work. It's one of the top reasons for a doctor's visit. Let's be honest, chances are you or someone you care about is in this group.
And for so many people, the conventional path just feels like a dead end. We get presented with this really frustrating choice. On one side, you've got pills that just, they mask the symptoms, but they never actually touch the root cause. And on the other, you have risky surgery, which for good reason is often a last resort.
So this leads us to a really crucial question. What if there's another way? A missing piece of the puzzle that could connect all the dots and lead to real, lasting relief?
All right, the very first step here is a major shift in how we think. We have to stop thinking of pain as the enemy and start seeing it for what it actually is, which is a signal. You know, Dr. Wendell Ellis puts it perfectly here. Pain isn't just something happening in your back. It's a message from your body. It's like this alarm bell, and it's screaming at you that the entire complex system, your bones, your nerves, your muscles, is completely out of whack. So when we just take a pill to make the pain go away, what are we really doing? We're essentially just hitting the snooze button on that alarm. We're ignoring the message, and all that does is delay any chance at true, real healing.
Okay, so if we decide to listen to that signal, where does it lead us first? Well, it takes us right to the body's foundation, its very framework. And a key concept we need to understand is subluxation. It sounds a little technical, but it's basically a misalignment in the spine. The best way to think of it is like a traffic jam on your body's superhighway, the nervous system. And when that communication gets disrupted, it messes with everything, from how you move to how you function day to day. And this is exactly where traditional chiropractic care comes into the picture. The adjustments are the cornerstone of this whole process. The goal is to clear that traffic jam, to correct the alignment, and to get those nerve signals flowing freely again, just like they're supposed to.
But hold on, what about the damage that's already been done? For so many people with chronic issues, just fixing the structure is only half the battle. And this brings us to what we're calling the missing link.
As Dr. Ellis points out, yeah, correcting the alignment is absolutely vital. But what about the inflamed, slow-to-heal tissues deep down, at the cellular level? That's where this missing piece of the puzzle comes in.
The scientific name for it sounds really complex, photobiomodulation, but the concept is actually pretty straightforward. It's therapeutic laser therapy. It uses very specific, targeted wavelengths of light to literally kickstart your body's own healing mechanisms deep inside your cells.
So how in the world does this work?
It's pretty amazing, actually. Okay, so first, specific light waves penetrate right into the injured tissue. Then your cells literally absorb that light energy. And this gives their tiny power plants, the mitochondria, a major boost. It supercharges the production of something called ATP, which you can just think of it as recharging your cellular batteries. And the result? Tissue repair speeds up and inflammation goes way down. So this is where it all comes together. This is the core of this whole person approach, combining the big structural fix with the deep cellular repair. It's where the macro meets the micro. Think of it like a two-pronged attack on pain. Chiropractic provides the macro fix. It's correcting the big picture structure and the nerve pathways. At the same time, laser therapy is providing the micro fix, healing the damaged tissues and knocking down inflammation at a cellular level. They're not doing the same job. They're working together. They're complementary. And look, this approach isn't just some nice theory. It's grounded in really solid evidence. A major Cochrane review, which is a big deal in medical research, confirmed that spinal manipulation leads to significant improvements. And a very recent 2023 systematic review found that laser therapy does the same, with effects that actually last even after the treatment ends. So what does this all mean for you? Let's get practical and talk about who might really benefit the most from this. So you're probably asking yourself, hey, is this for me? Could this actually apply to my situation? Well, this integrated path might be right up your alley if you're dealing with chronic pain that just won't quit, or if you feel like you've completely hit a wall with other treatments. It's also a great option if you're actively looking for an alternative to long-term medication, or you want to avoid the risks that come with surgery. Of course, anytime you hear the word laser, a huge question probably pops into your head. Is it safe? Any answer is a resounding yes. This therapy is FDA cleared, it's totally non-invasive, there are no serious side effects that have been reported, and honestly, the most that patients usually feel is just a gentle, soothing warmth during the treatment. Ultimately, everything we've talked about comes back to this one simple idea. The goal is not to just chase symptoms around, it's to treat the whole person by addressing the structural cause of the problem and healing the cellular damage that it created along the way. And that leaves us with a final and I think really powerful question to ask ourselves about our own health. Are we okay with just masking our pain? Or are we ready to look a little deeper and finally start healing its true cause?
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted, I had constant brain fog, and my hormones felt completely out of whack. Every doctor told me my labs were normal, and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything, my symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure, over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.